Why are more people getting cancer?
Did you know that if you sleep for less than 6 or 7 hours a night consistently, you have a 300 times increased risk of heart disease? We're so busy that I think we just focus on all the things that we think matter and we neglect our own health half the time.
So I'm doing my thing where I'm starting to lean in because I'm getting so listening to what I do. I'll be on top of you. It's so interesting. Sorry, let's get back into that. Yeah, that was so fascinating. That was oh my God, I need to get back in the room. I do that all the time, don't I? As soon as I get into something, I'm just like this. I forget that I'm actually needing to ask questions. Right, so fitness, so blah, 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 blah. Hello and welcome to another episode of Jill Spills. This week, we are going to be spilling the tea on all things health and from a doctor's perspective. Today, I am joined by the lovely Dr Frankie Jackson-Spence. Making sure I said that correct.
You did, thank you. Thanks for having me.
Pleasure. Thank you so much for coming on. I'm really looking forward to this episode. And we've got so much to chat about.
Always.
We're going to talk all things health. But first of all, let's start with who you are and what exactly you do.
Yeah. Oh, thank you for having me on. So I'm Dr. Frankie. I am a medical doctor. I am very active on social media. I post a lot of health-related content that's very much evidence-based. And that stems from the fact I've taken an academic career pathway. So I graduated as a doctor 6 years ago, and I now work in medical oncology. So I treat kidney and bladder cancer patients, and we do a lot of clinical trials. And as part of that, we are very heavily involved in research, so do a lot of projects. And so I'm really kind of interested in academic medicine and the evidence behind things. And so on social media, when I can see all of the health myths and so many people changing their lives based on, information that's not got robust evidence base behind it, I felt a real need to kind of step into that space and bridge the gap between the scientific evidence base and general people on social media that just want to live a bit healthier. So I kind of have two double lives, but they are quite nicely interlinked with kind of that evidence based backing.
What made you get into that? What made you get into medicine? Is it something you've always loved? It intrigued you? Is there family that are medical? Or?
Yeah, I always think I give a little bit of a underwhelming response to this. You'll meet so many doctors that will say, oh, when I was 5, I fell over and the doctors there were amazing and I just really want to be like them, or they've had some tragic thing happen to them, sadly, and they feel really inspired. Mine is not that exciting. I've always been really inquisitive. I've always asked why and questioned everything. I never take anything at face value. I always want to know, so why is that? How does that work? And I think that meant that I kind of leant towards science at school. But I also love people and I love this sort of thing. And so much of medicine is actually human psychology, human behaviours. Why do we do certain things that negatively or positively affect our health and well-being? So I thought the science and kind of people side of things would lend itself nicely to a career in medicine. And actually, you know what? So many people think that by choosing to be a doctor, that it's quite a narrow path and you have a real kind of set vision of what you want to do. It's actually not like that at all. It opens so many different doors. There's so many different specialties you can do. And so, yeah, that's kind of how it happened.
Lovely. So when you started going down to the routes that you're doing, you're going into research, explain a bit more about what research you're doing and what you're finding.
So I always knew I wanted to do oncology, and actually I played around with different specialties when I was at med school, but I remember doing some work experience when I was about 15 with a gynecological oncologist, and I just, when something really makes an impact on you, and I thought that's the sort of consultation I'm going to be having. And I really had that vision. And by nature, oncology is such a fast evolving specialty. If we look back over the last 10 years at the treatments we were giving versus now, the treatment landscape massively has changed. Rates of cancer are on the rise. 1 in 2 people will unfortunately get cancer in our lifetime. And I really wanted to work in that developing space where, my career is going to change 10 times over in my career lifespan. And so by nature, oncology does lend itself to research. Everything is trial-based. I'm very privileged to work at St Bartholomew's Hospital, and we have a huge oncology clinical trials department. So we basically, what I do day to day is I help administer and run phase 2 and 3 clinical trials. So basically what that means is, say there is a treatment available for kidney or bladder cancer, we will then test a new drug or a new combination of drugs against that and see which one's better and hopefully the combination will be better, and that will eventually become the new standard of care. So, over the last 6 years, I've worked in that department 4.5. We have run some trials that have ended up changing NHS treatment. So drugs that I was giving 4 or 5 years ago on a clinical trial are now available all across the country on the NHS. And we're not the only site to do that, but we're one of them. And the professor I work for leads a lot of those. So that's kind of one thing. And I'm also doing a PhD. So I'm basically investigating different things in bladder cancer and trying to improve the treatment for patients in that landscape. So I'm doing that as well.
That's amazing.
No, it's really interesting.
Yeah, I bet. So with the way, as you're saying, life's evolving and life is changing, and with technology, are you finding that research is becoming, you're finding things out a lot faster, a lot quicker, and treatment is getting quicker to patients? Or is there still an ongoing of time? It takes a lot of time to make it perfect.
So there's 2 answers to that question. You actually probably unknowingly have asked me 2 questions. The first is that there is a lot of investment in oncologies. When I say the stat that 1 in 2 people is affected by cancer, we all know someone who's unfortunately been affected. And what that means, let me say that. And so there is a lot of investment. There's a lot of funding in my area of cancer anyway, and in things like breast cancer as well. And so we can run trials. The drug companies are doing these clinical trials. So in that sense, things are moving quickly because everyone wants to find a new drug target. Everyone wants to try and combat these growing rates of cancer. And, on the business side of it, everyone wants to develop the drug that cures cancer. On the flip side of that, one thing that we really are limited by in this country is there's so many regulations. And so it does take a long time. So you can be running a trial and it will take several years for that to translate to it being available generally on the NHS.
Yeah.
And that's one of the reasons I love trials, because when I see my patients in clinic, I want to give them the best drug that's out there. And quite often that is a drug that's available on a clinical trial only.
Right.
And so I feel in a very privileged position that I can offer patients more options, I guess, because if I was working in a smaller hospital or in a more remote location, or wasn't as big a research department, I may not have all of those trial options. Of course, not every trial is positive. There's sometimes we test it against a drug and it's no better, rarely worse, but often no better. But still, you do get the success stories quite regularly. And so I really enjoy that.
What do you think, asking this question carefully, but why do you think cancer is more, why is more people getting cancer now?
Great question. I think it's a really kind of complex answer there. I think number 1 is that cancer is a disease that comes quite often with aging. So if you think about, if you have a bike, as you own that bike for longer and longer and the bike gets older, it will start to rust. Things will start to break. You have to start repair bits or replace bits. Maybe your seat gets ripped, or maybe your brakes start to go squeaky. That's kind of the same that happens with our body. And constantly what happens is every day we make new cells. Our cells turn over and regenerate, okay? Yeah. If you imagine that we have mechanisms in our body to repair any mistakes that are made. So when we're replicating our DNA, which is like our genetic code, it's like our instruction manual. This is how you make this cell and this is how it needs to function. Mistakes can be made. And we have machinery in our body that can fix those mistakes. As you get older, that machinery gets tired and more worn out. And so it's not as good at picking up those mistakes, and your immune system's not quite good at rectifying them. So essentially that's the very scientific reason for why cancers develop with age. The second thing is that we definitely have got better at picking up cancers. So I think years ago you might say, oh, someone died of old age, but what was really going on with them? There may have been an undiagnosed cancer that we didn't know about. Okay. And then the third thing, and we'll talk about this more, but people's lifestyles. As a population, we're in an echo chamber with the content we consume on social media, thinking everyone's healthy and in this health bubble. Yeah, that's not representative of the general population. We're actually quite a unhealthy and morbid population. We have rates of obesity higher than ever before. We have poor nutrition. We're despite the obesity, we're malnourished, essentially. We are very sedentary compared to what we used to be. We are not sleeping enough. We are, exposing ourselves to the sun. We're chronic stress. There's all of these things. We use recreational substances like alcohol and drugs and things like that. And so I don't think we're that healthy in the way we're living.
Right.
And so that can also contribute to development of many cancers.
Right. Okay. That's really interesting. Yeah, we're going to delve a little bit more into like the lifestyle of that kind of thing. How can people then be more aware of different type of like breast cancer and kidney cancer? Like, how can people be a bit more, have an understanding or be a bit more on it with things like symptoms and that? Is there any tips? Is there any things that people, I know there's so many different cancers, but in general, like what, I think some people are always afraid, aren't they?
Yeah. I think the first thing is that we can shift some of the blame, because less than 10% of the NHS budget is spent on prevention. So there needs to be a massive public health initiative to continue and improve education on what to look out for. That's the first thing. And for some cancers, we do well with that. I think you could ask a room of women and, quite a few of them would know how to check their breasts or the signs to look out for. Or same with things like smear tests. Most people are aware that what the reason for going to a smear test is. But there are other cancers like kidney and bladder cancer that I treat that we don't speak about as much. It's not as sexy to talk about. And so there is often a lack of education there of what to look out for. So where would I start with this? I think the first thing is we need better messaging, and that's on a public health level. I think individually, listening to podcasts like this and seeking information out for yourself. And I think the third is having the confidence to advocate for yourself, because there's two aspects of that. The first is the fear, and I really do empathize with this, because if you think something's wrong with you, the guts it takes to go and tackle that head on is quite a lot.
Yeah.
You can have a symptom and you can maybe associate that with cancer, like you might feel a lump in your breast, and immediately alarm bells are going to go on in your head and think this could be breast cancer.
Yeah.
And you start picturing all of the kind of life changes that go on with that. That's only natural. People always assume the worst. Just to kind of put a positive note on that, 9 out of 10 breast lumps that get referred to a breast clinic aren't cancerous.
Yeah.
So even though we assume the worst, it's often not that bad. So I think there's fear there. People put it off. I think as well, when you are seeing the news about NHS pressures, people also don't want to bother doctors. They are afraid of going to A&E, or they're afraid of going to their GP, or they can't get an appointment. And then the third thing, I guess, is just we don't put our own health at the top of our priority list. It's like when you get called for your cervical cancer screening, it's like an effort to arrange the appointment. It's like, oh, I'll do that next week. That's the general attitude of people. And we're so busy that I think we just focus on all the things that we think matter, and we neglect our own health half the time. And actually, when something bad happens to you, and I think the pandemic also highlighted this for people, that you can't do anything without your health.
Yeah.
And so that was a long-winded answer, but I think it's complex as to why people don't go with early signs.
Yeah, no, I don't think that was complex. I think that things like that need to be said, so how people can have a better understanding. We can keep this next winding or out, depending. Just highlighting a little bit on the cervical cancer side of things. What are your thoughts on the age where people start having? Because I myself have a daughter who's going to be 25, so she's only just now eligible to have a smear.
Yeah.
Do you think that will change, or is there a reason behind why that's that age that it begins for them to allow to have a smear?
Yeah, so essentially cervical cancer, the majority of cases, I think it's 99 or 98% of cases, are caused by a virus called human papillomavirus, HPV. And that's transmitted through sexual activity. So pretty much everyone who's been sexually active will get the virus, and it's not a sexually transmitted infection, although it is sexually transmitted infection, if that makes sense.
Yeah.
And essentially, most people get it and their immune system will clear it. So within 1 or 2 years, you usually have the infection, no symptoms, no problems, and then it's cleared from your body.
Okay.
Some people either pick up a high strain of the virus, which I think is strains 16 and 18, but I'll have to double check that. And or their immune system just doesn't clear it for some reason. And so the virus can linger and it can cause changes in the cells of the cervix, and those changes eventually become cancerous. Now, the kind of history of how that happens is the virus is there for a bit, it may or may not get cleared, then it starts to cause abnormal cells and they're precancerous, and then they may turn to cancer. And so the history of how the disease develops tends to be over several years. And so thinking of the age that people first become sexually active, the chances of developing cervical cancer younger than 25 are not zero, but they're small.
Okay.
And so when we have these public health screening tools, they are always assessing benefit versus risk. So
Right.
benefit to the patient and then risk, and that can be, the risk of going through a procedure because nothing's harm-free, and also the cost, I guess, and also the anxiety as well of going for it. So I guess the rationale is that the need for it is not as high when you're you're younger. Obviously, there may be people even listening to this who have been affected by a younger age, and they're going to hugely advocate for it being available at a younger age, but that's kind of how the public health policies are made.
Right. Okay. No, great answer. I think a lot of people, myself again as a mum, question those sort of things. So moving on slightly, because I could ask you thousands of questions with cancer related, but moving nicely into what we was going to discussing, lifestyle is a big part of this, and obviously our lifestyle has changed dramatically, as you said. So you're massively into fitness.
Yeah.
You are hugely into fitness, which is great. You do a lot. How does it? I mean, we all know fitness is good for us. We all know, stay healthy, eat well. But going, as you say, into the medical side of things, how important really is fitness to incorporate into our lives?
So I guess one thing I want to caveat here is that there's two types of fitness, I guess. The first is what you and I will often chat about, which is going and exercising.
Yeah.
So we go to the gym, or we go on a run, or we do some sort of fitness class.
Yeah.
And that is maybe 1 hour of our whole day where we're engaging in exercise. And so I hugely love exercise for, the benefits to my health, but also I love having that 1 hour in my day to myself.
Yeah.
Usually in the morning, I get up and it's some me time before the world takes all of my energy. On the flip side to that, we can have people that are engaging in exercise, but then are largely sedentary. And actually, we also need to look at our activity levels throughout the rest of the day. So if you go to the gym for an hour, that's amazing. You're doing so much good for your health. But also have a think, are you just sitting down for the rest of the day? Not walking at all on your commute, not walking to the shops because you're, ordering your food or you're shopping. And so there's two levels of fitness, and that I'm talking about from, someone who's relatively fit and healthy perspective. I guess the third angle of fitness is general, like, physical shape, particularly when talking about older people, and frailty is a big problem. Having some muscle mass, and for that person, fitness might look like being able to stand up out of the chair and go and put the kettle on themselves.
Yeah.
And it can be that simple. And so why am I so passionate about exercise? I think, let's break it down. There are short-term and kind of long-term benefits of exercise. So in the short term, exercise, increases your mood. It causes your brain to release lots of hormones like dopamine, serotonin, adrenaline, all of kind of, well, from your brain, but all of our happy hormones, and it makes you feel good. So if you're feeling stressed or anxious, you may instantly feel relieved of some of those symptoms, and it boosts your mood. It can help with sleep that evening. It can paradoxically give you more energy. It can help you regulate your blood sugar levels, your blood lipid levels, all of these things. In the long term, I think if you ask people kind of, oh, why do we go and, go for a run? And you think about heart health. But actually, I can't name a single disease really that exercise doesn't help with. Exercise and people who regularly engage in activity, however that may look, have lower risks of type 2 diabetes, strokes, heart attacks, pretty much every type of cancer, brain aging, things like Alzheimer's and dementia. All of these things exercise has a positive effect on.
Yeah.
And so the benefits are huge. And I get really frustrated sometimes because you hear people beating themselves up because they had a bad workout or because their body's not changing.
Yes.
And I think, honestly, how you look is the least interesting part of exercise. What it does for your health is so profound. And what I love, and I want more people to know, is that say you embark on an exercise program because you're trying to lose weight, which is completely fine. All of those benefits I've just mentioned are independent of your BMI. So even if you don't lose weight, you know, your blood glucose control is going to be better, your blood pressure is going to be better, we're going to lower the amount of bad cholesterol, the high density lipoproteins in the blood, you'll have these protective benefits on your brain and from cancer and boosting your immune system and all that. So really, the benefits are just so profound. And I think so many of us, myself included, get into fitness because you want to change how your body looks. And really, that's like the icing on the cake.
Yeah, yeah. So I'm thinking that I'm so fast. I'm sorry. I'm doing my thing where I'm starting to lean in because I'm getting so listening to what I do. I'll be on top of you. It's so interesting. Sorry, get back into that. Yeah, that was so fascinating. That was oh my God, I need to get back in the room. I do that all the time, don't I? As soon as I get into something, I'm just like this. I forget that I'm actually needing to ask questions. Right, so fitness, so blah, 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 blah. So with the fitness side as well, there's the other elements. Obviously, it affects with men as well, but mainly women because we have a lot more to deal with hormones. So obviously, the menstrual cycle, you know, the way we can train can affect how we are on the day, or as you say, you know, we can have some good days, bad days with training. Perimenopausal women, how can we factor those in to get, you know, to women that are premenstrual or, you know, things like that, because there are changes in your fitness or your health at those times, isn't there?
Yeah, absolutely. So if we think about a typical menstrual cycle, the textbook duration of the menstrual cycle will be 28 days. No one really is 28 days, but let's just keep it as that for kind of explanation purposes.
Yeah.
So if you split that into two halves, the first half of the menstrual cycle is when eggs are developing in the ovaries ready for ovulation, and that's called the follicular phase. Now in this period, estrogen levels rise, and estrogen is a anabolic hormone, so it helps us build things, like build stores for a potential pregnancy, and it just makes you feel great. So it's like your superwoman hormone. So you might have more energy, you might be sleeping better. If we put this into a kind of gym perspective, you might find that you just feel fitter. Like you could go on a run a certain pace and it feels easy, and then 2 weeks later you go on the same run and it feels like, I'm really unfit. How did I even manage this pace 2 weeks ago? And that could be due to fluctuations in the hormones. If you think about building muscle or strength in the gym, you might pick up weights and they feel like manageable, and then 2 weeks later it's more difficult. That's kind of, estrogen has a role to play with that. Not fully. I think there's other things to consider, like, you know, your nutrition, how well slept you are, what training load has been throughout the rest of the week. But it's interesting. And when we think about there were some interesting studies as well that showed estrogen has positive effects on things like type 2 muscle fibers, which are used in high intensity interval work. So things like I do, like F45. And then you ovulate and the egg's released, and basically the shell that the egg was released out of is called the corpus luteum. I'll get all sciencey now. And that becomes like a progesterone producing machine. And the purpose of progesterone rising in the second phase, which is called the luteal phase, is because progesterone preserves the lining of your womb.
Yeah.
So if that egg was to go and get fertilized, then you want it to implant on the endometrial lining, and progesterone will help that happen. And then if the egg is not fertilized, that little shell, the corpus luteum, will degenerate, progesterone levels drop, and the whole cycle starts again and you have a bleed. And so in the second phase, progesterone becomes the dominant hormone. Now, progesterone works, put simply, kind of oppositely to estrogen. So it's a catabolic hormone. So it's about breaking down your energy stores for a potential pregnancy. So you might feel in this time everything like a bit more lethargic. Progesterone can also increase your kind of core body temperature. So if you think about how that might affect your rate of perceived exertion when exercising, it can affect your VO2 max, it can affect your sleep, and essentially things in this phase may feel just more of a struggle.
Yeah.
And this is the time where I think we need to like cut ourselves some slack.
Right.
We always think of the menstrual bleed and the period, I guess, as the most interesting part of the menstrual cycle. And actually, some women have really easy periods, but really struggle in the luteal phase because progesterone causes havoc on them.
Yeah.
The changing levels of progesterone as you approach the menstrual bleed can cause premenstrual syndromes, things like mood changes, mood swings, irritability, difficulty sleeping, tiredness, breast tenderness, headaches, spotty skin. You then got all that. Then you might have a bleed where you get menstrual cramps. And so we have all of these things happening. And I think the takeaway message is you're not expected to show up the same every single day of the month.
Yeah.
And so if some days you're raring to go with your fitness levels or your general activity levels, that might be in part because of your hormones. And if on another day you just don't feel like it, it's probably not because you're just being lazy.
Yeah.
It may be because if you've got your hormonal profile not really in your favour. That being said, there is actually some data that shows people who do suffer with premenstrual syndrome and menstrual cramps separately, exercise can help with their symptoms. So I like to think I still want to do exercise because it's just part of my routine, but maybe I will just do something a bit less intense, like yoga or Pilates.
Yeah, I was going to say, should you change up the workout at that when those cycles are going? Would it benefit someone bringing it down?
So there's not really any hard and fast evidence that we
Yeah.
should be doing this kind of cycle syncing. I think it's just a bit of a phase, but I like the idea that you may tweak what you're doing rather than just being like, I said I'm going to come and test my 1 rep max in the gym, and so I'm going to do it today because I said I was going to.
Yeah.
I'm actually being like, you know what, today's not the time.
Yeah.
And just like being more kind to ourselves.
Yeah, and just with individual and how
Yeah.
people work, and
Yeah.
that works. You say it works better for them if
Yeah.
they train harder or less.
Yeah.
Or just touching a little bit on with alongside that. So with perimenopause, most postmenopause, a phase everyone knows I'm in. Obviously, that really does play havoc with your hormones, and everything is going like haywire.
Yeah.
And things seem to, in my personal opinion, accelerate a lot more. The the tiredness, the lethargy, it just everything is just seems to excel tenfold.
Yeah.
How can someone out there who's going through all of that, what can they do? Again, I know it's an individual thing, but what could they potentially do to have a better understanding of why the body's doing that?
So I think there's 2 things here. I think the first is that when a teenage girl goes through puberty, we really cut teenagers slack. We say like, oh, you're really hormonal, or like you might be moody and irritable, and we kind of like, oh, they're hormonal, going through puberty, we'll allow it. And then, not that I've been through menopause yet, but women who go through menopause have lots of responsibilities. They probably have careers, they may have children, and the same allowances are not made for them. You're just expected to crack on with life.
Yeah.
When actually it's this huge physiological shift. It's a huge physiological overhaul, similar to puberty. And you're right, the hormonal profile is completely out of whack. And that can actually happen for a couple of years prior to menopause.
Yeah.
Menopause is the moment when you haven't had a menstrual bleed for 12 months. But actually perimenopause, as you mentioned, is where your hormones are like this for a period of years. And that effect can be quite profound on some women. And everyone's different. So what can you do? I think the first thing is, when staying on the topic of exercise, one of the best things that someone going through perimenopause and menopause can do is resistance training, because 2 problems with faced with menopause. The first is that the reduction in estrogen levels that come with menopause can mean that women are at risk of reduced muscle mass and osteoporosis, and so increased risk of bone fractures and just generally becoming more frail and sort of accelerating aging in that sense. And so engaging with resistance exercising and preserving some of that muscle mass can help prevent some of those problems and the problems that come with it. I think as well, one thing that women can also suffer with is that their metabolism massively changes.
Yeah.
So you can be eating the exact same, start to gain weight, and in a different distribution. And that in part is due to the reducing muscle mass and the reducing estrogen levels. And so resistance training can also help with that. I think when it comes to menopause management, I'm not a menopause specialist, so I'm not the right person to guide individually. But what I would say is advocating for yourself again, you will hear lots of strong opinions about what the right thing to do is. Some
Yeah.
people will be really pro hormone replacement therapy, HRT, and some people will say, well, I didn't need it. And that's great for you. And some people will say, we are replacing something that's supposed to reduce. I think educating yourself and seeking out information about both options in a balanced way and assessing the pros and cons and your own symptoms and how much those symptoms are affecting your life and making the decision is right for you. We should be supporting women either way.
Yeah.
What I don't think we should be doing is saying, oh, your hormone levels are reducing, we should replace them, to everybody, because some people don't need replacement and it does come with risks. But I also don't think we should be seeing that replacement as a weakness or a failure for not being able to tolerate the symptoms.
Yeah.
So I think we just need more individualized care there. And it's really difficult because menopause tends to be something that women go to their GP about. And if anyone's been to the GP recently, it's quick appointment. It's 10 minutes appointment. And this is a big thing.
Yeah.
This needs a discussion like this that goes on for, a much longer time. So it's a really difficult one.
Just before we move on a little bit, just my personal question is, do men have a similar, like, with issues with hormones? I know they've got much more testosterone, but can that fail? Can they get issues within themselves as well? I know it's never, apparently there isn't, I say apparently male menopause is spoken about, but can men suffer?
So I think men have their own reduction in so yes, in some ways, although I wouldn't necessarily call it male menopause. And men with age will see a reduction in testosterone levels, and that will come with its own problems and changes. So it may be things like, changing hair pattern or baldness, weight gain, problems with sex drive and libido or performance, and things like that. So I think men also do undergo changes based on a changing hormonal profile, mainly testosterone. But it isn't the same as women. It isn't, I wouldn't say, and again, I'm not a man that's been through it, but it's not, from a physiological perspective, as much of a massive overhaul as menopause.
Yeah. So, talking about the male and female, another thing I wanted to discuss, which is massive for both, is stress. Now, stress is a massive thing. Again, someone like myself going through menopause, stress is huge because you're trying to deal with your changes. Again, it could be for a younger woman as well. And men, lifestyle, going back to that, working. I think it's more and more people are facing stress more now than ever, I personally think, because of the way life is, and it's so fast paced. And obviously back in the COVID day, everything slowed down, and now we're a lot more faster. How much of an impact on your health can stress have?
This is a great question, and I'm really glad we're speaking about this, because I think we are almost expected to tolerate a level of stress that I don't think is wise. I think, if you engage with something unhealthy, let's say being really sedentary and not exercising, or consuming alcohol or drugs or whatever, you know the risks, and you can choose, you're making an informed choice. Do I want to engage with those things when I know it's not that good for me? With stress, I think it's something that really creeps up on us, and it affects me as well. This is kind of a do as I say, not as I do scenario, but let's break stress down. So there are the obvious stresses in our life, things like having, people dependent on you, and you've got to think about yourself and maybe children or pets or people that are carers, these kind of stresses. We have stresses with relationships like arguments, tension, irritability, problems at work with colleagues. People have financial stress. You might have a job interview or, some sort of thing at work. That's kind of like, if I say, what is stress? They're the sort of things that people are going to name. And everyone's stress will look different. And I am also very aware that some people have like stress privilege, I guess. Some of the things that, I might get stressed out about. So someone in a less fortunate position, their stress is completely different. Yeah. Maybe it's 6 children all living in a 1-bedroom apartment, or financial worries. And lots of things I see working in East London as a doctor. Everyone's stress is their own, and we will value it the same. But that's the kind of obvious stress. But there's also this kind of like micro stressors that just creep up on us each day that we need to be more aware of. So let's take us through a standard day. So say it's winter. It's not right now. It's actually quite a sunny day.
Yeah.
But we
For
would
once.
usually wake up to an alarm. Stress number one. Most people snooze their alarm. Then they have to wake up to another alarm. Stress number two. It's dark outside. So your body's internal body clock, your circadian rhythm is automatically out of whack. Stress number three. Then you go on your phone and you read a work email, or you go on social media and you're consuming information, or you see something you don't like. Stress number 3, 4, 5, 4, 5, 6.
Yeah.
Then you, let's say you go and exercise and you've not eaten breakfast and you're just putting your body through stress. Although I'd say exercise stress is good. More stress. Then you are rushing for work, another stress. Then you miss your tube or your bus, or you can't find a parking space. Then you go to work and you have all your stresses. Then you come home, you've not had enough sleep. That's another stress. You have an argument with your partner or your kids or whatever. There's all these there's these stresses, and I think lots of them people don't think about.
Yeah.
So what happens in our body? Some stress is a normal response. So we have a stress response. It's activated by our sympathetic nervous system, and it was intended to be switched on for kind of a fight or flight response. So if back in the day you were being chased by a lion, you would kick in your sympathetic nervous system, your adrenaline would be released, the stressor would go to your brain. It causes part of your brain called the amygdala and the hypothalamus to release stress hormones, basically. And then your heart rate races faster, so you pump more blood around your body so that you can use your muscles to run away from the lion. Your breathing rate increases to get more oxygen in. Your endurance increases, all these types of things. And it's intended to be there for short bursts. Then you get out of danger and your parasympathetic nervous system, which is your rest and digest kind of way of thinking about it, kicks in and dampens that stress response. Now, what's happening in our daily life is that this stress response is happening inappropriately many times throughout the day and for a prolonged time. So it's day on day on day on day. And we're not really closing the stress cycle. So I don't know if you've heard of the stress cycle. It's like the alarm phase, which is this stressor activating all the hormones. Then you have a resistance phase where you're it's alarm phase. Yeah, resistance phase where your parasympathetic nervous system tries to calm things down. And then if it doesn't successfully do that, or the stressor's still there or comes back, exhaustion phase, which is basically where you start to get the negative health effects of stress. So why is it bad for our health? This stress response over a prolonged period can do things like raise your heart rate, raise your blood pressure, which over time can increase your risk of heart disease, like heart attacks and strokes. The prolonged stress hormones can cause problems with our mental health, on our mood. It can affect our sleep. And sleep is a whole nother conversation about what that does to our health if we're not getting good quality sleep or enough of it. It can cause general inflammation in your body. Stress can dampen your immune response. And so that can cause you to feel run down, when we're stressed and we get run down and we pick up coughs and colds. But also our immune system has a huge role to play, as we mentioned before, in cancer development and things like that. So essentially this prolonged stress response can cause havoc with our body. Hormones is another thing. What's sometimes seen in women is something called hypothalamic amenorrhea, which is where there's essentially so much stress on your body that it feeds back to your hormone producing glands in your brain and in your pituitary gland to say, don't produce the hormones that make you fertile, because right now is not a safe time to have a baby. Right. So stress hormone increases, and then we don't get that same rise and fall of estrogen and progesterone, and so you don't ovulate, and so you might not have a menstrual period. And so there's lots of ways stress can manifest itself, and lots of things that can go on kind of beneath the surface and in your blood and things like that you can't necessarily feel. We often just associate stress with how it feels in our mind, but there are these things happening to our body as well.
Because that's what I was just going to, you just mentioned, highlighted exactly what you just said there. Sometimes you can't feel a lot of people won't be aware that you can get inflammation, that your body's getting inflamed or your immune system's taking, people just go, I've got a cold, but they're not necessarily thinking where that's stemming from. is there a point, if you are leading quite a stressful life, maybe work, all the factors that you've put in, that you can start noticing before it gets to that extreme level where it's making a massive impact? Is there something where you can go, okay, this isn't looking good right now?
I think that if we're honest with ourselves, which some people aren't, because we do, like we mentioned about not wanting to face the symptoms and things. If you're honest with yourself, there are usually telltale signs of whether you're well. You know, are you sleeping well? Are you able to fall asleep at night without things playing on your mind? Are you waking up and feeling refreshed? Are you having a menstrual period? Are you feeling stressed in your head? Are you feeling irritable and snappy, or are you feeling like light and breezy? That kind of thing. I guess you might not necessarily feel it, but you might have a routine health check and find that you've got high blood pressure. You know, we're very quick to just give a blood pressure tablet, but let's have a think about what's causing the high blood pressure. And stress is one cause of high blood pressure. So there's usually symptoms, or you might be getting loads of coughs and colds. There's usually telltale signs. I think people deep down, if they're honest with themselves, know if they're stressed.
Yeah.
And I think, how can we reduce that stress? So there are some things that are unavoidable, and I think we just need to be more conscious about how we're living. Society is just quite fast-paced now, and I was thinking about this recently. I was stood in the post office queue, and I was there doing my emails, and I was like, I think we're supposed to just stand and daydream when we're in the post office queue. You know, we're supposed to just people watch and chill out and give your brain a rest.
Yeah.
We don't need to be doing emails or responding to things. And I think that is where we need to be more conscious with our time. What I do every morning is when I wake up, which is usually in the dark, to an alarm. Okay, I can't really avoid those things because I want to exercise before work, but I don't check my phone until I finish the gym.
Right, yeah.
So I don't check emails or social media. So I'm consciously choosing how my morning looks, because if I see a work email that I need to respond to, it's going to distract me from the thing that's helping me reduce stress, which is exercise. Or I might see something on social media I don't want to see, or something's going to make me feel bad about myself, or I'm going to remember I didn't make a deadline or something. So being more conscious, I think we need to schedule more like dead time in our day. You know, now we don't just sit and do nothing. We don't sit and rest. We sit and watch TV, or we sit and watch TV and scroll on our phone.
Yeah.
Things that are restful, we now see as a luxury rather than as a necessity.
Right.
You know, if we just like, why do we love going and getting like a facial or our nails done or something like that? I think it's because it's a break that you're just allowing yourself for a bit of pampering.
Yeah.
Where you're not, and you don't feel guilty for it. We just need more dead time in our day, I think. We need to stop this whole productive all the time.
Do you think people feel guilty? Do you think,
I think
the life
so.
we're living, people feel guilty for stopping?
Yes, I think so. I think you go onto social media and it looks like everyone else is doing things all the time.
Yes.
Everyone else, there is always someone else that's doing more than you. It's so easy to make that comparison. And it's, even if it's not productive, we have lost the ability to just sit. We have to always be stimulating our brains with things now. If I challenged you now to just sit in silence, you'd be itching to check your phone.
Oh my God, yeah, I'd be the worst person.
His brain is like now seeking that dopamine, and it's just a habit. It's a really bad habit. And so I think we need to be, when I was talking about how to reduce stress, there's some things that are avoidable and some things that are unavoidable. And I think we need to find ways to close the stress cycle, however that might look for you, whether it's exercising or doing a hobby or talking or having a cry or, you know, writing down your thoughts or playing an instrument, whatever it looks like for you, thinking I'm having some time now to reduce my stress levels. And then the second thing is, some stress is unavoidable, but some is avoidable. So my journey here was rushed.
Yeah.
I could have set off 10 minutes before and it wouldn't have been rushed, and I could have saved myself a bit of stress. And so we could be more conscious about, you know, getting a bit more organised the day before, or getting up 5 minutes earlier to give your time to sit and have a cup of tea and it not be on the go or everything rushed.
Could even going for a walk still be fine, but having that, like, again, nothing, not even music, just going for a walk or walking your dog. And
absolutely,
I've done it. I've walked my dog and I'm still having a little look on my phone and couldn't tell you what the dog's doing.
Yeah, well, your dog is clearly well trained,
Yeah,
because
yeah,
if I did that, I would not see her the dust.
Oh, yours is still a pup. But I think, again, our world has become as you've said, it's the social media. We feel like we have to be continuously dipping into it.
And I'm guilty of that as well, by the way.
Yeah, I mean, same.
Some of this is like theory, but I just think we need to live more consciously. If we're trying to be healthier, like there are some things that are actually quite easy changes we can make. We just need to be more conscious of them.
Do you think we could, it probably is an obvious answer, but if we really did, we could bring stress down a hell of a lot. Like if we really, but you know, some people might be listening and go, oh yeah, but I've got to do this in the day and I've got to do that. You know, there's going to be people that go, how? When do you expect me to do it?
Yeah.
Like it is possible, right?
And I think the changes people need to make, and this is the same for nutrition, exercise, stress, hormonal health, whatever we've talked about, they're smaller than you think. You know, it could be sitting for 5 minutes and like doing some deep breathing, which sounds really woo-woo, but there's actually a lot of evidence that that's switches on that parasympathetic nervous system, which is the rest and digest, and that helps close the stress cycle. Or doing something you enjoy that relieves stress, not doing it because exercise is something that's on your to-do list, but because you actually enjoy it. Or what else might it look like? It might look like having a bath or going for a walk or having a conversation to offload your thoughts from the day. All of those things could take as little as 5 minutes.
Yeah.
But they're a step in the right direction. I'm not saying people need to go and meditate for an hour. It's just putting in these breaks. You know what I used to do? My calendar used to be blocked. Like 1 till 2 this, 2 till 3 this. And there was no time. Now I'll just put like buffer time in.
Yeah.
Like I need to get from here to here and that's going to take 5 minutes. But it's taking 5 minutes.
Yeah. And you know you've got that 5 minutes available.
Yeah. Or like, but also it actually gives me the amount of time in the next block that I've actually set myself.
Yeah.
And then the other thing as well is it could be, you know, going to bed 15 minutes earlier.
Yeah.
We don't get enough sleep. That's a massive stress on our body. Did you know that if you sleep for less than 6 or 7 hours a night consistently, you have a 300 times increased risk of heart disease? Yeah.
Really?
6 or 7 hours
my
a
God.
night of sleep. 6 or 7 hours a night of sleep is more than what most people are getting. 2/3 of people do not get enough sleep. And that's a massive stress on the body.
That is really fascinating.
We know rates of things like heart attacks and strokes are higher in people who work night shifts. And it's all because of this the sleep thing. So, it could be.
So realistically, anything between 7 to the 8 hour, realistically, what you should be getting each night.
Yeah, I think everyone's different. So I've actually always been quoting that 7 to 9 hours thing. I actually need 9 hours.
Yeah.
I've realised that if I get less than 9 hours, I don't feel refreshed.
Yeah.
Which is very hard to do. I think there's few people that will listen to this and think I can get 9 hours sleep. I don't get it either.
No.
But it could be, I'm not thinking, okay, I can't get 9 hours, so I may as well go to bed for 6 hours. I think, okay, I can't get 9 hours. I can get 6, but if I'm organised and I'm conscious about this and intentional, I can get 15 minutes more by going to bed 15 minutes earlier instead of scrolling on my phone or watching another series or something. Yeah. And so the changes people need to make, I keep going off on long-winded answers, but the changes people need to make are smaller than you think. You can't just overhaul your whole life. We're all in our routines. People have got responsibilities. It's so difficult to just say, I'm going to start spending 6 hours a week doing this one healthy thing.
Yeah.
Just make it easy. 5 or 10 minutes a day of consciously practicing that. And then it's just part of your routine then.
I think that's the big point that you just said there. I think everybody goes, they've got to do everything at once, that massive overhaul, and then I can't do it. Then that becomes a stress.
That's why people can't stick to their fitness regimes, because they go on a 12-week gym program that requires them to go to the gym 5 times a week. So for 12 weeks, they don't socialise and they're struggling to fit it in. And then at the end of the 12 weeks, can't fit that in. But could you fit in a 10-minute walk every morning? Probably.
Yeah.
Just need to make it easier. There's a great book called Atomic Habits by James Clear.
Okay.
And it basically teaches you how to build habits that are sustainable. And I think he always says the motto, like, what is it? Make it small and make it easy.
And it's so easy.
But the thing is, there's actual evidence that the small things still work. You know, going to bed 10 minutes earlier is having positive benefits on your health. Sitting and trying to actively reduce your stress for 10 minutes is going to have positive effects on your health, because you're not doing them once. You're going to do that, you know, a few times a week over hopefully years. It compounds. It's all a cumulative thing. So, yeah, make it easy.
Well, I think as well, like for people listening, hearing that, hopefully that will make a difference, because again, as you're saying, like that 5-10 minutes might make a difference, rather than everything's got to be done in a as you say, a 6 or a 12-week block, and then it's well, I can't, what was the point? And they're adding stress to that by doing that. And I think that's a really big almost impact to say that everybody's got 5 minutes. No matter how busy you are in a day, everyone has got 5 minutes. And
I'd agree, and it's how you choose to spend those 5 minutes, because you might not have time. If someone's listening to this and I've just spoken about all the benefits of exercise, and they currently do no exercise, thinking, how am I going to fit in the gym or an exercise class or a run? I don't have that space in my week. But it could be doing 5 minutes of movement. It could be literally doing a few exercises at home, or going out for a short walk, or what else could you do? Like getting some weights and doing like a few resistance exercises. All of those things, you could do it for 5 minutes, and that 5 minutes, exactly,
resistance band,
or even your own body weight. But that 5 minutes will make a difference. We have this weird attitude where we need like arbitrary values. It's like lots of runners will never go on a run that's less than 5 kilometers. Who says 5 kilometers is the healthy amount? Who says that 15 minutes running isn't enough, or 10 minutes running isn't enough? In fact, the science actually shows that even short durations, if done regularly, are beneficial. So I think we just think, oh, why bother?
Yeah, it's very easy just to sit back. You've also, I mean, I could go on. This could go on for hours. I have so much to ask. You've also got your own podcast as well, and it's called again
Vision of Health.
So, and that's where you have a load of experts on talking about all different various subjects. Am I correct?
Yes.
So people want to find out more. You've mentioned something today, and they're like, I want to know more.
There's probably an episode on it.
Yeah, probably. Yeah.
Essentially, what I try and do is pick a pillar of health, so nutrition or exercise or stress or mental health, and then delve into the evidence behind that particular subject with a different expert each week. So there's definitely more information about all this.
Yeah, I think you've definitely got to pop onto that podcast and listen, because I could literally go on for hours. I've got my brain. I'm just like, what can I ask? But I know we've got time. Thank you for coming on. I have thoroughly enjoyed today, and would love for you to come back on again. I think there's so much more we could talk about. Yeah, there is. So thank you.
My pleasure. Thanks for having me.
Dr. Frankie Jackson-Spence, and that's where people can find you as well. And yeah, have a lovely chilled afternoon.
I need it.
You do.
You too.
All right, thank you.